Hi, this is Dr. Daniels, and welcome to Healing with Dr. Daniels. This is Sunday, December 1st, 2019, and today's topic is: should your cardiologist be recommending dog ownership? Yep, you heard that right. I tell you, you cannot make this stuff up. But first, let us take some turpentine. Yay! So I have my unmarked bottle of turpentine. You should label yours though, because unlike me, you probably do not live alone. So you don't want the hazard of someone else not knowing what's in the bottle and doing something inappropriate with it, like taking a swig or something. All right. So this is about 2.5 cc's, which is the same as half a teaspoon. And we have here some white sugar. And we're going to just squirt this right here. Doop 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 doop. Yep, you should see that getting nice and gray. And we have some distilled water. Yes. All right. That is done. Now, we're going to take some Shilajit. Shilajit is black and tarry and tastes a tad bit icky. So we're just going to take a little paddle full of this. You can see how much is on there, about 200 milligrams. Put it in our water, let it dissolve. Now, usually I tell you I'm going to take it later and I don't get around to it. So I have some dissolved in water right here, ready to take. There you go. Now, leaving this in the water like this, it's going to dissolve, and you'll see the water turns color as it dissolves. But usually, I get caught up and distracted by the show and don't get around to it. So today, we have solved that problem. All right, so should your doctor, cardiologist, be recommending dog ownership? The first thing we have to take a look at here is, okay, what does your cardiologist recommend and how effective is it? And let's look at the evidence. Okay, so there was a study that did this. I said, okay, we've got a bunch of people, their average age 65, and they've had bypass surgery. We're going to presume this is for heart disease, right? Coronary artery bypass surgery, heart surgery for heart disease. Yay! And we're going to look at what their 10-year survival rate was. And so this is their 10-year survival rate with maximal medical intervention, right? They've got surgery, they're taking medicine, they got a lifestyle change, all this stuff that they're doing. And so the question is, it's always nice to ask the question. That's how else could you possibly get the answer except by asking the question. So they took a look at these people who were average of 65 years old, and the question was, how long did they live? Well, it turns out that in 10-year period, only 70% of those who were alive at 65, this is average, only 70% were still alive in 10 years, okay? And they've had maximal medical intervention. All right. Well, what if you're just a regular old American randomly walking down the street? What is your chance, if you're 65, of being alive 10 years later? Well, I happen to look that up. There's actuarial tables. You can, all this is known stuff. It turns out 79%. So 79% of healthy people, or let's say undiagnosed people, will be alive in 10 years. But those who've had health problems, heart problems to be precise, and have had the standard of care, 30% of those will be dead, or 70% will be alive. So you can see already a 9% kind of loss. All right. Well, the next question is, what about those folks who didn't get open heart surgery, right? Heart disease, didn't get the standard of care. Well, what happened to those people? for this, we can look as far as a doctor called Dr. Ornish, and he did studies showing that lifestyle changes alone would reverse heart disease. In other words, would return that heart disease person back to the pool of random healthy people. Or I should say random people undiagnosed with heart disease. Okay, so what we've got here then is we have a 70% 10-year survival. And the question is, what can we do to improve that? And we have a control group, regular Americans, 79% chance of being alive in 10 years from the age of 65. Now, if you had a whiz-bang perfect drug, perfect surgery, perfect medical intervention that could restore a person to average health, in other words, that could take this person's chance of being alive in 10 years from 70% and increase it to 79%. I do believe we would call that a wonder drug. Mm-hmm. We would call that a wonder drug. You know what? We have something better than that. Yes, we have something better than that. And to find out about this something better, we only have to look to our friends at Medscape. And this is what they say. They are awesome. I tell you, I like these guys. They do so much research and produce so much data. And it says, heart's best friend, dog owners have longer life expectancy after coronary events. So this is a group of people who are similar to our group of 65-year-olds who received the standard of care, and 30% were dead after 10 years. Let's see what dog ownership does. Just to clear the air, I do not own a dog. I did own a dog years ago, and it was a positive experience. But at the moment, I do not own a dog. Now, I also would like to say that this research was done on dogs, not cats, not birds, not hamsters, dogs. Okay, so we're going to go over what this study showed. So this is hot off the press, October 21st, 2019. A dog is not only man's best friend, but companionship from a dog may also have a positive effect on an owner's cardiovascular health. That's a big word for heart. Even lengthening their lifespan. Holy cow, according to research. This is the essence of a prospective study and a meta-analysis looking at the cardiovascular risk and survival of dog owners. And so this is really a very strong study. So you just take a bunch of people and you observe over time what happens to them. And that is an extremely powerful type of study. So these two studies provide good quality data indicating dog ownership is associated with reduced cardiac and all-cause mortality. This is important because you only die once. I know it may sound ridiculous to you, but here's the deal. If you have heart disease, take a pill, and you die 2 weeks later, not from heart disease, from something else, you don't care because you're just as dead. So what you really want the doctor to do, or anyone that's helping you, is to provide you an answer that's going to protect you from all causes of death over a period of time. So, and this is a failure of many heart disease interventions, whether it's high blood pressure medication, whether it's taking cholesterol-lowering drugs. Oh yeah, your heart disease death rate goes down. But all the other causes of death rise up so high that there is no benefit to your longevity. But again, as an individual, the thing is, you only get to die once. So if you eliminate one cause of death or minimize it while increasing other causes of death, you really haven't gained anything because you'll be just as dead and you're dying just as soon. So what you really want is something that's going to increase what's called all-cause mortality, which is going to increase your absolute chance of being alive for a longer period of time into the future. We're not talking immortality here, just maybe making it another 10 years. Yeah. And so this was shocking. So based on previous studies, which had shown that social isolation and an inactive lifestyle have a negative impact, researchers wanted to establish to what extent dog owners would get health benefits from the companionship of their four-legged friends. So they know that a person's social situation, like whether you're divorced or whether you're married, whether you're employed, whether you're not, certain social circumstances have an impact on a person's longevity. And so then the question was, hey, what about dog ownership? What about dog ownership? And so it's a meta-analysis, and they had 10 studies, follow-up of up to 22 years. So this is a long period of time over which they looked. And most of them are from Scandinavia and England, in which the connection between dog ownership and mortality rates was investigated. And so previous research showed that dog owners have lower blood pressure and better cholesterol levels, implying, not sure, but implying better heart health. However, it was unclear if dog ownership is associated with improved survival. And so as previous studies have yielded inconsistent results, according to the team of authors led by Dr. Kramer of Mount Sinai Hospital in Toronto. All right. Are you ready for the results? I mean, drum roll, please, because this is amazing. A 65% reduction in all-cause mortality in individuals who had prior coronary events. So if you've had a heart attack and you have a dog, or you, by golly, go get a dog, then you will have a 65% reduction in your chances of dying in the next 10 years. This is absolutely shocking. And so our findings suggest that having a dog is associated with longer life. Yet don't say. Although confounding factors such as better fitness or healthier lifestyle were not taken into consideration in the analysis, the results appear to be very positive. The next step on this topic would be an interventional study. In other words, take people who don't have dogs, give them dogs, and say, you better take this dog, and see if they live longer. And so to evaluate cardiovascular outcomes after adopting a dog and the social and psychological benefits of dog ownership. I can only say for myself, when I was going through my stressful period with losing my license, being put on do not employ list, I went and got a dog, and that dog was just an incredible help. Just saying. Dog benefits for people living alone. And so it's another study. A team of researchers from Sweden used data from the Swedish National Patient Register to conduct a prospective study on the survival of dog owners compared with non-owners following a major cardiovascular event. And so in other words, in this other country, they actually have documented data on who owns a dog and who doesn't own a dog. And they used this data and cross-referenced it with the data on people who had heart attacks and who didn't have heart attacks. Okay. The register identified 181,000 heart attack patients, 5.7% of whom were dog owners, and 154,000 stroke patients, 4% of whom were dog owners. So results show the chances of survival for those owning a dog were clearly better, especially for dog owners without a partner or children. So dog owners who lived alone had a 33% lower risk of death after hospitalization for heart attack compared with non-owners, while those who lived with a partner or child were only at 15% lower risk compared with heart attack patients without a dog. So if you have no dog, no spouse, no children, live alone, your heart attack risk is a certain number. If you have a spouse, that number is reduced by 15%. If you get a dog, it's reduced by 30%. Now, this may be striking, but we'll digress from this study for a minute, and we're going to go take a look over to none other than the American Heart Association. In fact, the Journal of the American Heart Association. And their information is encouraging in some ways and not so much in others. But the background is, little is known of the impact of social factors on mortality after coronary artery bypass grafting. We explored sex, age, marital status, income, and education to see what impact these things had on survival. So, what they found, to cut to the chase, was being married or living with a significant other, 32% benefit. That's pretty good. But doesn't touch the 65% all-cause mortality benefit of a dog, just saying. If the person had an income issue, the lowest income, I'll call it poverty, compared to the highest income, we'll call it wealth, 44% benefit. So in other words, they're 44% less likely to die if they had more money or were not in the poorest percentile. And education, interesting, was associated with higher risk, only 15% excess risk due to lack of education. And so if a woman, for example, was unmarried, low income, and low education, that's three of these factors, 10 years after surgery, mortality was 18%, compared with 11% in married women with high income and higher educational level. So really, this is a marginal benefit of 7%, or in gross numbers, but in absolute, it's a benefit of about 30%. So what does it tell you? That these different risk factors, social risk factors, are not additive, that there's actually overlapping. And so, for example, somebody who is married, that would give a 44% benefit, and someone who is educated, that would give a 15% benefit. So now we're into 55, 60% benefit. And then you have the poverty benefit, which is 25% or so. That adds up to a substantial benefit of almost 80%, but that's not what you see. What you see is only a 30% benefit at best. And so these numbers, well, hey, benefits benefit. It does not beat having a dog. And just to tell you how striking just having a dog is, let's do the other math on this. Here it is. Okay. So if we take a look at the other math, 65% reduction in all-cause mortality. Remember, the American Heart Association only looked at heart disease mortality. They did not look at all-cause mortality. And in many heart studies, all-cause mortality, there's no benefit, even though there's benefits seen in cardiac mortality. But with dog, man's best friend, we have a reduction in all-cause mortality of 65%. So, in other words, if we take the 30% death rate, which we expect at the 10-year point, and we reduce it by the 65% all-cause mortality, well, it's like, holy cow. Now, this person, heart disease basket case, has an 89.5% chance of living 10 years compared to 70%. So their gross mortality in 10 years is only 10.5%. And whereas if you take someone in the regular population at 75, they're going to have a 21% chance of dying in the 10 years after age 65, or their gross longevity is going to be close to 79 years. So to go from 79 years to 89 years is a major, or not 79 years, 79% to 89% chance of being alive over a 10-year period is a fabulous gain in longevity. And what this does for the cardiac patient actually is improves their health to much greater than the average population. Let's say the non-dog owning population. As far as you cat owners go, they have not yet done the cat study. I don't know if the numbers would be the same or not. Can't say. But we do know about dogs. So the domesticated dog, being a pet owner, not just any, like I said, not a cat, not a bird, not a hamster, a dog, has been shown to reduce all-cause mortality by 65%. And so it's clearly worth it to get a dog. And that's even a greater benefit than being, again, American Heart Association, their numbers, than being wealthy, married, educated. All of these socially presumed to be beneficial things do not confer anywhere near the benefit of owning a dog. So the next question then is, well, what is dog ownership? I had to look this up. Because I owned a dog, but, as other things, I might not have owned a dog the way everyone else owns a dog. And so what I have found is I was indeed correct about that. Well, I will say, for me, owning a dog was totally stress-free. Totally stress-free, and a major benefit to my state of mind. So we have here Reader's Digest, as good an authority as anyone on how to own a dog. I will tell you what they say you should do, and I will share with you what I did. 10 things you need to know before getting a dog, and it's really what to do when you have a dog. 1, a dog is for life. And they tell you owning a dog is a lifetime commitment. Animals develop deep bonds with you and your family. Any change in ownership can be extremely traumatic. So you should be prepared for the responsibility involved in dog ownership. You need to provide shelter, food, water, medical care, love, and attention. Okay, so my dog, I did not make a lifetime commitment. I was committed, and I wanted to keep my dog. However, when I went overseas, I realized that it would be difficult. And also, my dog did not have any vaccines, had never been to a vet, and was doing just fine. She was not neutered, she was not spayed, whatever. And I just couldn't see putting her through that trauma. So I gave her away to a very loving family. My God. Yes, they vaccinated her, but they gave her her own room. They gave her clothes and toys. I didn't even recognize her. She did recognize me, though, because I would occasionally, I felt guilty giving her away. So I actually stopped back by about, I think 2 years later. I said, well, I guess I got to take my dog. Oh, my God, they burst into tears. I said, oh, wait. I was just coming by because I thought she was a burden to you, and I was going to give her away to somebody else. They said, oh, no, let us keep her. I said, you know what? She's yours. And so that was that. But a dog is for life. If you say the dog is for life, it'll stress you out. Don't do that. A dog is to love, and just love your dog for as long as you can. And if you find that you cannot love your dog or provide your dog the things you think your dog should have, then be okay with giving your dog to someone else who maybe can do those things, whatever they are. And so all my dog got from me was shelter, food, water, and love. And she did get attention, but she got no medical care, none, whatever. Owning a dog can be expensive. Owning a dog is also considered a considerable financial commitment. The average care for one dog, which includes foods, supplies, and basic veterinary care, averages $800 to $1,000 a year. So my dog did not get any veterinary care. She did get food. Supplies, a leash and a collar. That was it. So we didn't have any dog clothes or nothing. Just a leash and a collar. And so my dog was very inexpensive. And I did buy dog food, but she was a little Chihuahua and did not eat much. So you can see by throwing in these veterinary thing and the veterinary bills and the lifetime commitment, they're creating a lot of stress in this dog ownership situation here. Buy your dog accessories in advance. Dog accessories. What's that? Before you take your new dog home, make sure you have all the basic supplies. These include a dog collar. I bought that after the fact. ID tag, we didn't bother with that. Rabies tag, we didn't get any shots. A leash, I did get a leash. And a water bowl and food bowl, we did get those. And a comfortable dog bed and toys. We did eventually get a dog bed for her, but she came with a cage. 4, find a good vet for your dog. Nope, did not stress myself out. I didn't even look. Create a safe home for your dog. We had a pretty non-toxic house. So here it says, dog-proof your home. Be sure to keep anything that might be toxic to your pet out of reach. Key things to look out for are poisonous plants. Didn't have those. Plastic bags? Nope. Chemical cleaners? Nope, we didn't have those. And if you're unsure, call the Pet Poison Helpline. Nope, didn't have that. Be prepared for house training. We really did not house train the dog. We should have. But the best house training is to take the dog for a walk every day at the same time. So puppies require house training as they will not automatically know that the yard, not the house, is the appropriate place to do their business. And you have to teach them. So this is a little Chihuahua, and I'm embarrassed to say, but we just picked up after her. So, relax. What can I say for those of you who want to improve your health by having a pet? Either get one that's already trained. Get one that's already trained, or be prepared to train it. Allow your dog to be social. I lived in a really rough neighborhood with pit bulls, and on at least one occasion, they wanted to take my poor little Chihuahua apart in pieces. So we did not allow her to be social. Her social sphere was the immediate family and maybe an extended family on holidays. But I think if you allow your dog to be social by taking your dog to pet parks and taking your dog here and taking your dog there and worrying about your dog's social life, that will stress you out. So you can be your dog's social life. I mean, that's the whole point of this. Be prepared to groom your dog. They want you to brush your dog's teeth. I never once brushed my dog's teeth. She didn't lose any either. She had no teeth problems. But I never once brushed her teeth. I might have cut her toenails once. And I think we gave her a bath once a month. But this level of grooming that they want you to rise to, I think would stress anyone out and definitely might cancel out your cardiac benefits. So ease your dog into a grooming routine and increase to a full grooming session. Be sure whoever is grooming a dog pets it frequently, and your dog is rewarded in the end. Your dog's nails should not touch the ground. Your dog should be brushed regularly. This will prevent tangles and reduce the risk of skin irritation. Your vet can help you plan an appropriate grooming schedule for your particular dog depending on breed and hair type. Honestly, to tell our heart patients they have to take the dog to the pet groomer on a schedule, again, that level of stress might cancel out the cardiac benefits. And then, of course, be sure about your decision. Above all, make sure that getting a dog is a wise decision for you, your family, and your living situation, not just now, but 10, 12, even 15 years from now. Now, this is a cardiac patient, right? So this person's chances of living to be 10 years even without the dog is 70%. Not great. And so you might say, why even give them a dog because they're not even going to live that long? So really, I think the best thing is to get a dog and do the best you can. And if it doesn't work out, you can always give the dog to someone else or sell the dog on Craigslist or eBay or something. But I think for someone who's never owned a dog, who's considering getting a dog, it's really difficult to project into the future if this is really going to work out. Also, before I got a dog, I felt, okay, dogs, that's a nice idea. I've got 3 kids, and they all want a dog. I did not realize how attached I actually became to the dog, and I really liked the dog a lot. So you really, for someone who is not a dog owner or has not owned a pet or a dog, it's difficult to predict really how positive a situation it actually will turn out to be. So I would say, no, you don't have to be sure. You just have to enter it with an open mind. And if you're unsure, you can even arrange an exit. Have a friend or someone who says, hey, you know what? If you don't like the dog, I'll take the dog. And that would be a better way to go about it. But you definitely don't want to go about the dog situation so as to stress yourself out. So the answer, should your cardiologist be recommending dog ownership? Abso-friggin-lutely. Because dog ownership is way more effective in terms of saving lives, increasing life expectancy, than really anything else in his bag of tricks. It is more effective, apparently, than surgery, more effective than any and all the drugs that they recommend for people, and even more effective than becoming wealthy, getting married, getting advanced degrees. So all these other even lifestyle, cultural type interventions one could make don't have anywhere near the impact of owning a dog. Yes. And so, of course, the next step then, if your doctor is going to be recommending a dog, does he need to write a prescription for the dog type that's just right for you? Probably not. But this is, clearly a case where a natural, non-toxic approach to a very serious disease. This is heart disease. It's killing 30% of the people who have it in 10 years, right? Even if they've had surgery and everything else to handle it. And that 30% mortality, it measures those who survived surgery. So it doesn't even count the 2% plus death rate that happens in the operating room, like on the spot. So this is really a startling, stunning, beneficial maneuver. I would say for anyone who has heart disease, for Christ's sake, get a dog. And make it easy on yourself. You don't have to get a high maintenance dog. Get a low maintenance dog. Get a, small, quiet dog. Or, hey, you can't reach to that level? No problem. Get an itty-bitty stuffed dog. Work your way up to it. But it is definitely, definitely worth it. It appears that it's even more, obviously, it's more important than even lifestyle dietary changes. All Dean Ornish promises is that you're going to be restored to healthy like other people who never had heart disease. Well, that only reduces your death risk from 30% down to 21%. Get a dog. Reduces that death risk down to 10.5%. That is huge. And where is the 6 o'clock news and all this? What do they have to say? Just one thing to take a look at is, you have Mayo Clinic. I love the Mayo Clinic. So Mayo Clinic, they're in the business of this, right? They do surgery. So you look up, heart surgery. What's the deal with heart surgery? Ask the one question. What is the benefit? That's one question. But another real question is, how much longer am I going to live? Is this surgery going to help me live longer? Let's see what the Mayo Clinic says. They say, overview. Coronary bypass surgery redirects the blood around a section of a blocked artery. Okay, great. Although coronary artery bypass surgery does not cure the heart disease, it can ease symptoms and reduce the risk of dying of heart disease. And this, as I told you, it does not reduce your overall all-cause mortality. Does not go down. You just are going to die of something else besides heart disease. Why is it done? It's done because you have chest pain. It's done because you have a diseased coronary artery. It's done because another artery is diseased. It's done because you have an artery blockage. So it's like the same reason repeated 3 times. So it is not done to increase your life expectancy. Okay, the risks are shocking. You could bleed, you could get irregular heart rhythms, you could have infections, memory loss, kidney problems, stroke, another heart attack. Excuse me, what about the benefits? Can you guys tell benefits, please? And it says how to prepare, what you can expect during the procedure, after the procedure. Expect to spend a day or 2 in the intensive care unit. Doesn't sound like a benefit to me. Cardiac rehab. Doesn't sound like a benefit to me. If you don't have complications, you'll be discharged within a week. Doesn't sound like a benefit to me. Expected recovery of about 12 weeks. Really? Doesn't sound like a benefit to me. And the results. Your results and long-term outcome will depend on following a healthy lifestyle recommendations, including stop smoking, follow a healthy eating plan, achieve and maintain a healthy weight, exercise regularly, manage stress. They didn't mention the dog. They did not mention the dog. But the point is, they didn't even list any concrete benefits of the surgery, like living longer. No. And your outcome? Depends. I say, get a dog. Get a dog. And like I said, you can start with a stuffed dog that doesn't do anything. You can start with the one that barks every now and then. Then you can start with, and then build up to a real dog. And then you can kind of think about, well, do you need a little dog, a medium dog, a large dog? What kind of dog do you want? But I say, if you have heart disease, don't mess around. Get a dog. Now, really, it's just that simple. I wish I could sit here and tell you, what supplements to get, what vitamins, diet, but that's not what the research shows. The research shows is that if you get a dog, it is a total life-extending experience as well as quality of life experience. And I would like to say, again, if you get a dog you don't like, pass the dog on to someone who likes him and try another dog. Maybe the dog you got was too hairy. Maybe the dog was too large. Maybe the dog was too noisy. Whatever. And then just the next time, make a decision that is informed by your experience. And you'll do very well. So that is great. Now, I know a lot of you are waiting for the Vitality Capsule sale. Me too. So our web guys are working on it, and I'm going to give them another week to work on it. And then I'm going to work on it. And we will definitely have a sale one way or another before the new year. Okay, so that brings us to questions. We have got some really neat questions this week. All right. First, we have a question from Taryn. Taryn says, I am suffering with vertigo and need to know what to do. If I ingest, we'll say that means eat, anything that has aspartame in it, I will lose my balance and will experience spinning in my head. I deliberately read ingredients to avoid aspartame. I mainly eat raw, but occasionally will eat and indulge myself in my weaknesses. Taryn does not tell us what the weaknesses are here, although that would be good to know. What can I do to eliminate the symptoms? Thank you. All right, so we got a few things here. This person is reading ingredient labels. That is not a good sign. That means they're eating processed food. So, Taryn, what you need to do is you need to cook your own weaknesses, whatever those things are, and embrace the sugar. Embrace the sugar. Make your own treats and add sugar instead of any artificial sweetener. Do not use any artificial sweetener. Jump right to it. Either use evaporated cane juice or white sugar, either one. But do not attempt to purchase artificially sweetened items because they might have aspartame in them but not have it listed or have it listed as another name. So that's the thing to do. Avoid the aspartame by making your own sweets. And do not buy anything that says unsweetened or sugar-free. But let's get right to the point. Why does aspartame have such a negative effect on you? Because it's a problem. Get that. But yeah, I agree with you. You should be able to have some aspartame by accident, a little smidgen, and maybe not having a reaction to it, or maybe aspartame, I don't know, twice a year and not have a problem. What's wrong with that? So we have here the answer in your eat raw. So you have mainly a raw diet, which means you have no cholesterol and no animal fat in your diet. It is the cholesterol and the animal fat that maintains your brain and protects it. So literally your brain is defenseless. So there's two ways you can go. If your brain is defenseless, then just don't expose it to aspartame by preparing your own treats using sugar. Like maybe you use honey or something. Or the other option would be to add some animal fat, such as chicken liver. Yeah, chicken liver is good enough. Probably chicken liver would solve your problem here. Maybe 4 ounces daily for about a week, and then once a week. Yep. Okay, Addie. Addie says, an associate recently underwent chemotherapy for several months. It resulted in severe pain. It means this person did not have pain before they underwent chemotherapy. And extreme itching in the hands, feet, and scalp. That would make this person totally immobile. They can't use their hands or their feet, and their scalp itches too. This is like misery. Is there anything to provide some relief? Yes. You want to give this person total and complete sympathy and be a good friend. I would not even tell her that you talked to me. Just ask her if there's anything you can do for her or whatever. Just leave it at that. So what's going on here? What's really going on here is the chemotherapy is pooling in and clogging up her small blood vessels, especially in the skin and the extremities. And this is simply a chemotherapy side effect. What could she do? Well, she could do what she would not do in the first place, which led her to do chemotherapy. So that's why I say to don't even. So you have to realize when the best thing you can do for someone really is to just be a good friend. Kind of like a dog we talked about earlier in the show. Yes. You need to be a good friend and a good companion. What could she do? Well, if she would, she could increase her water intake. She could stop her non-water beverages. She could have 3 bowel movements a day. She could do those things. Will she? She might not. Would she appreciate hearing from you? No, she would not. So be a good friend. Okay. Here is another question. I think it's from Addie. I'm not sure. It says, I have glaucoma. All right. Those of you who don't know, glaucoma is elevated pressure in the eye, in the front of the eye. But because the pressure is so high, it pushes the eyeball back and crushes the nerve and blood vessel supply, causing blindness. All right. So that's glaucoma. In other words, the end point here is blindness. And this person had glaucoma surgery. And so the reason you have glaucoma surgery is because the doctors say that the pressure in the eye is what is causing blindness, or even better, future blindness that you haven't got yet. And I can't tell you all the people I knew, as patients, when I was practicing medicine, they would get the glaucoma surgery, and they still have glaucoma. I'm like, well, what happened there? So let's see what happened here. I have glaucoma and had surgery to relieve the eye pressure or go blind. Surgery was successful, but I am losing my sight. In other words, the surgery to prevent blindness was successful, but I'm still going blind. This is a kind of reasoning that guarantees the medical industrial complex has nothing whatever to worry about. Can you imagine if you took your spouse to the doctor did surgery, the doctor says the surgery was a success, but your spouse died during the procedure. Like, what? That's not success. Same thing. So if you had surgery for the purpose of preventing blindness and you're still going blind, then the surgery was not a success. But wait, maybe it was. In the doctor's eyes, the surgery is a success if he gets paid and you survive the surgery. So in that sense, the doctor had a success. You have not had a success. I am diabetic also as of 4 years, but had glaucoma for over 20 years. Surgery was done in 2019 and 2018. So this person said 2 surgeries. Again, how strong is your faith? So you had glaucoma for 20 years, but not until the diabetes, for whatever reason, did you decide to get surgery. Maybe you noticed a decline in your vision. So I'd like to suggest to you that the diabetes was the real issue. The glaucoma never was. So the first thing is to fix your diabetes. That's number one. But number two, let's just say all you have is glaucoma. Because some people just have glaucoma, they don't have diabetes. So people who have just glaucoma, no diabetes. If they switch to a vegan diet for a month or two, the glaucoma clears up. And then they can reintroduce small amounts of meats of their choice, making sure that they eat meat that is not contaminated with hormones or pesticides. Okay, Terry says, my wife has a hiatal hernia and chronic cough. She also has celiac. So all we know is that his wife has a chronic cough. So there are many different symptoms one can or cannot have with celiac. So we don't know what other symptoms she's having, although celiac generally involves the intestines, although it can sometimes involve the brain as well. We don't know. And a hiatal hernia, again, we don't know. We don't know if she has burping. We don't know if she has heartburn after eating. We don't know. But we do know there's a chronic cough here. Okay, let's work with the cough. We have known this for years and have made diet changes and used supplements, and there's no improvement in her condition. What would you suggest we try? Again, the only thing we know that she has is the chronic cough, because we don't have any other information here. So, with a chronic cough, the number one cause of a chronic cough is dehydration. So, the thing you do is take your wife, put her on a scale, and she's going to have a weight in pounds. Divide that by 50, and that's how much water, distilled water, she should drink every day. Her other beverages, set them aside, whether it's coffee, whether it's tea, whatever, just set it aside. And that generally improves the cough tremendously, just even in 24 or 48 hours. So we don't have any more information, so really can't say anything else here. Okay, Mary Lou. Interesting. Mary Lou says, I know you promote distilled water, whatever that means. I certainly recommend it. However, I read that Prill water is supposed to taste better than any commercial water. Okay, so stop right there. Distilled water is not commercial water. You buy a distiller, you distill it yourself. So this is not commercial water that you're buying in a bottle. So in other words, the Prill claim that they are the best tasting bottled or commercial water is probably true, but it has nothing to do with water you distill yourself. Okay. And it is supposed to be purified and cleansed from toxic chemicals. That's entirely possible. I'm interested because the Prill stones are more portable than carrying around a distiller or distilled water in jugs. But I wanted to get your take on this water. Is it valid or is it false? Okay, so everything you said is true but irrelevant. How about that? It's true but irrelevant. So, if you look up the whole Prill situation, which I did, you take these stones, you put them in a gallon of water, and you wait. Set your watch. You wait 24 hours. 24 hours. Probably what happens is it removes toxic chemicals. What about the parasites in the water? Oh, not them? Oh no, we leave them alone. They're okay. So the whole Prill process does not affect parasites. And so when you distill the water, you're getting rid of the parasites and the toxic chemicals. So the whole Prill process would not be anywhere near as effective as a distiller. However, who wants to carry around a distiller? I mean, I travel sometimes, and what do? Carry a distiller? Heck no. So I carry a life straw. What's a life straw? A life straw is a portable filter, which is about the length of this spoon and about an inch and a half in diameter, and fits nicely in any luggage or purse or whatever. And not only that, it has one end that screws as an adapter onto any common soda bottle. So you can just put your unpurified water in your soda bottle, screw on the life straw, and squeeze it into your mouth, and you've got water. So that would be the solution. All right, let us see. So this is Joe, and Joe says, I recently had an ultrasound. What for? There's the question. So the real piece of information when you have a particular test is like, why did you get the test? So Joe says, I still have sludge and one stone about the size of a dime. I don't have any pain. Ding, 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 ding. So if you don't have any pain, this stone could sit there as it's sitting the rest of your life and not give you any problems. But I think I have a low-grade infection, sometimes hot and sometimes normal. Okay, so the simple answer is increase your water intake. Again, go stand on a scale. Figure out your weight in pounds, divide it by 50, and that's how much water to drink. And that will cool you down. And increase the amount of vegetables, raw and cooked, that you eat. So he says, I feel fine otherwise, which is more than and better than you're going to feel after gallbladder surgery, I'll tell you that. And I work to fix things around the house and grounds. Oh, okay, so yeah, you get around, do a lot of stuff. The doctors are getting bent out of shape because they want me to get the gallbladder taken out. So that's the doctor's problem. You need to tell them that they need to go talk to someone else about their need to do surgery and collect money, that you're not a part of that program. It seems the only time I get any seizures, is when I pig out on veal and steak. Well, there you go. Just don't pig out on veal and steak. Eat smaller portions of veal and steak. And avoid the doctors. Skip the doctors. And just cut back on your veal and steak. You can still have some veal. You can still have some steak. But just cut back to below your seizure amount. All right. Okay, Carol. Carol really sent in an amazing question. And she says, in a recent blood test, my partner had a low, that's 57, creatinine level in a recent blood test. Again, the question is, why did he have the blood test? We don't know. 57 is a high, creatinine level. So is this something to worry about, and can it be corrected? He is a 73-year-old male. All right, so Carol, this is a really excellent example why it's so important not to get blood tests. So first of all, 57, if it is a creatinine level, he would be deceased or already on dialysis. So we know it's not a creatinine level, it's a creatinine clearance level, otherwise known as GFR, glomerular filtration rate, which is the rate at which creatinine is removed from the blood. Okay, so you've been given a test that you totally don't even understand, and they throw this number at you and they tell you it's low. And so now you're in a panic. And the answer is yes, it's low. However, low for who? Low for what? So we're pretty sure, because it's 57 and this person's alive, that it was a creatinine clearance test. Now, the normal range for this test is between 88 and 128. It's like, oh my God, it's 57 is a lot lower than 88. Yes, it is. Unless you are black, then it's the low number is 60. But wait, this person is 73. So what do we have to do? We have to look up the normal range of this test for a 73-year-old male. So what better place to go than the International Kidney Society? Yes. This is the official journal of the International Society of Nephrology. That's kidneys. And what do they say? Well, they've done some testing. And they say, my bad. Creatinine clearance varies greatly with age. And if this person is 73, let's just say that they're 73, between the ages of 70 and 74, a normal creatinine clearance for a healthy 73-year-old with a 95% confidence interval, that means 95% of healthy people fall in this range, is between 54 and 92. Yay! What does that mean? It means that a creatinine clearance of 57 in a 73-year-old male is normal. This is consistent with good health. If you want to do anything, you might want to substitute water for what he's drinking and just really help him enjoy the rest of his life. Do not do any more tests. None. So you should absolutely ignore it. Don't worry about it at all. For Christ's sake, ignore it. And no more blood tests. All right, that is it for today's edition of Healing with Dr. Daniels. Please go to vitalitycapsules.com and visit our sponsor, Vitality Capsules, and also get your free report, The Candida Cleaner, which talks all about the wondrous healing properties of turpentine.